When we started talking about the treatment of acute coronary syndrome, we had an overview where we said that the treatment is subdivided into two. Okay, there will be treatment where you're actually doing at the emergency unit. That's when the patient actually comes in. Then also, there are some treatment that you are basically there are some treatment that you are doing later in the hospital. Okay, so for the later in the hospital treatment is what we're looking at. Okay, later in the hospital treatment. Okay, so okay, you basically stratify the risk. Okay, try to find out all the risk factors that the patient has. Then you do further investigation. All right, then as the patient is in the hospital, they should still be practicing what lifestyle modification. You mobilize them, then you rehabilitate them. Okay, so in the absence of complications, patients can mobilize on the second day and return home between 3 to 5 days. Okay, then they can return work basically between 4 to 6 weeks. Okay, then you should address the emotional problems that the patient might have. Then for the rehabilitation programs, you have graded exercises. Okay, so you tell the patient about all of this. Okay, so that they'll be doing all those mild exercise and all of that. So for secondary prevention therapy, you can be given low dose of aspirin, and this is for life. You combine it with clopidogrel for about 3 months. Then you can use beta blockers. You can use what angiotensin converting enzyme inhibitors. You can use angiotensin receptor blockers. You can use aldosterone antagonists. Okay. Then coronary revascularization can help. Then device therapy, where that's where I do what implantable cardiac devices. Okay. So I think that's it for what an overview of the later in hospital management for acute coronary syndrome. So we'll be taking each of those what treatments, okay, and be talking about it as we continue.